Hey Alpha Nurses, I'm Nurse Sandro from alphanursguide.com. This is NCLEX PN Review Lesson 48, Maternity and Pediatric Medication Questions. You can get my study guides on Etsy. You can follow me on Facebook, Instagram, and TikTok for more content. All links are in the description. Without the way, let's get started.
Question 1. Methylergonovine is prescribed for a woman to treat postpartum hemorrhage. Before the administration of methylergonovine, the nurse should check which priority item. A. Uterine tone. B. Blood pressure. C. Amount of lochia. D. Deep tendon reflexes. The correct answer is B. Blood pressure. Rationale: methylergonovine, which is an ergot alkaloid, is an agent that is used to prevent or control postpartum hemorrhage by contracting the uterus. Methylergonovine causes continuous uterine contractions and may elevate the blood pressure. A priority before the administration of the medication is to check the blood pressure. The healthcare provider should be notified if hypertension is present. Although options A, C, and D may be components of the postpartum data collection procedures, but option B is related specifically to the administration of this medication. Question 2. The nurse is monitoring a preterm labor client who is receiving magnesium sulfate intravenously. The nurse should monitor for which adverse effects of this medication. Select all that apply. A. Flushing. B. Hypertension. C. Increased urine output. D. Depressed respirations. E. Extreme muscle weakness. F. Hyperactive deep tendon reflexes. The correct answers are A. Flushing, D. Depressed respirations, and E. Extreme muscle weakness. Rationale: magnesium sulfate is a central nervous system depressant, and it relaxes smooth muscle, including the uterus. It is used to stop preterm labor contractions, and it is used for preeclamptic clients to prevent seizures. Adverse effects include flushing, depressed respirations, depressed deep tendon reflexes, hypotension, extreme muscle weakness, decreased urine output, pulmonary edema, and elevated serum magnesium levels. Question 3. A pregnant client is receiving magnesium sulfate for the management of preeclampsia. The nurse determines that the client is experiencing toxicity from the medication, if which is noted on data collection. A. Proteinuria of 3+. B. Presence of deep tendon reflexes. C. Serum magnesium level of 6 milliequivalents per liter. D. Respirations of 10 breaths per minute. The correct answer is D. Respirations of 10 breaths per minute. Rationale: signs of magnesium sulfate toxicity relate to the central nervous system depressant effects of the medication and include respiratory depression, a loss of deep tendon reflexes, and a sudden drop in the fetal heart rate, maternal heart rate, and blood pressure. Therapeutic serum levels of magnesium are 4 to 7.5 milliequivalents per liter, or 5 to 8 milligrams per deciliter. Proteinuria of 3+ is likely to be noted in a client with preeclampsia. Question 4. Epidural analgesia is administered to a woman for pain relief after a cesarean birth. The nurse assigned to care for the woman ensures that which medication is readily available if respiratory depression occurs. A. Betamethasone. B. Morphine sulfate. C. Naloxone. D. Meperidine hydrochloride. The correct answer is C. Naloxone. Rationale: opioids are used for epidural analgesia. An adverse effect of epidural analgesia is a delayed respiratory depression. Naloxone is an opioid antagonist, which reverses the effects of opioids and is given for respiratory depression. Morphine sulfate and meperidine hydrochloride are opioid analgesics. Betamethasone is a corticosteroid that is administered to enhance fetal lung maturity. Question 5. Immuneglobulin is prescribed for a woman after the delivery of a newborn infant, and the nurse provides information to the woman about the purpose of the medication. The nurse determines that the woman understands the purpose of the medication if the woman states that it will protect her next baby from which condition? A. Having Rh-positive blood. B. Developing a rubella infection. C. Developing physiological jaundice. D. Being affected by Rh incompatibility. The correct answer is D. Being affected by Rh incompatibility. Rationale: Rh incompatibility can occur when a Rh-negative mother becomes sensitized to the Rh antigen. Sensitization may develop when a Rh-negative woman becomes pregnant with a fetus that is Rh-positive. During pregnancy and at delivery, some of the baby's Rh-positive blood can enter the maternal circulation, thus causing the woman's immune system to form antibodies against the Rh-positive blood. The administration of raw immunoglobulin prevents the woman from developing antibodies against Rh-positive blood by providing passive antibody protection against the Rh antigen. Question 6. A woman with preeclampsia is receiving magnesium sulfate, which indicates to the nurse that the magnesium sulfate therapy is effective. A. Scotomas are present. B. Seizures do not occur. C. Ankle clonus is noted. D. The blood pressure decreases. The correct answer is B. Seizures do not occur. Rationale: for a client with preeclampsia, the goal of care is directed at preventing eclampsia. Magnesium sulfate is an anticonvulsant, rather than an antihypertensive agent. Although a decrease in blood pressure may be noted initially, this effect is usually transient. Scotomas are areas of complete or partial blindness. Visual disturbances, such as scotomas, often precede an eclamptic seizure. Ankle clonus indicates hyperreflexia and may precede the onset of eclampsia. Question 7. Methylergonovine is prescribed for a client with postpartum hemorrhage. Before administering the medication, the nurse should question administration of the medication, if which condition is documented in the client's medical history. A. Hypotension. B. Hypothyroidism. C. Diabetes mellitus. D. Peripheral vascular disease. The correct answer is D. Peripheral vascular disease. Rationale: methylergonovine is an ergot alkaloid that is used to treat postpartum hemorrhage. Ergot alkaloids are avoided in clients with significant cardiovascular disease, peripheral vascular disease, hypertension, eclampsia, or preeclampsia, because these conditions are worsened by the vasoconstrictive effects of the ergot alkaloids. Question 8. The nursing instructor asks a nursing student to describe the procedure for administering erythromycin ointment to the eyes of a neonate. The instructor determines that the student needs to research this procedure further if the student makes which statement. A. I will flush the eyes after instilling the ointment. B. I will cleanse the neonate's eyes before instilling the ointment. C. The administration of the eye ointment is within 1 hour after delivery. D. I will instill the eye ointment into each of the neonate's conjunctival sacs. The correct answer is A. I will flush the eyes after instilling the ointment. Rationale: eye prophylaxis protects the neonate against Neisseria gonorrhoeae and Chlamydia trachomatis. The eyes are not flushed after the installation of the medication because the flush will wash away the administered medication. Question 9. A 31-week preterm labor client, dilated to 4 centimeters, has been started on magnesium sulfate. Her contractions have stopped. If the client's labor can be inhibited for the next 48 hours, which medication does the nurse anticipate will be prescribed? A. Nalbuphine. B. Betamethasone. C. Misoprostol. D. Raw immunoglobulin. The correct answer is B. Betamethasone. Rationale: betamethasone, which is a glucocorticoid, is given to stimulate fetal lung maturation. It is used for clients in preterm labor, between 28 and 32 weeks gestation, if the labor can be inhibited for 48 hours. Nalbuphine is an opioid analgesic. Misoprostol is a prostaglandin that is given to ripen and soften the cervix and to stimulate uterine contractions. Immuneglobulin is given to Rh-negative clients to prevent sensitization. Question 10. The nurse is caring for a client who is receiving oxytocin to induce labor. The nurse should discontinue the oxytocin infusion if which is noted on data collection of the client. A. Fatigue. B. Drowsiness. C. Uterine hyperstimulation. D. Early decelerations of the fetal heart rate. The correct answer is C. Uterine hyperstimulation. Rationale: oxytocin stimulates uterine contractions, and it is one of the common pharmacological methods used to induce labor. An adverse effect associated with the administration of the medication is the hyperstimulation of uterine contractions. Therefore, oxytocin infusion must be stopped when any signs of uterine hyperstimulation are present. Fatigue and drowsiness may be caused by the labor experience. Early decelerations of the fetal heart rate are a reassuring sign and do not indicate fetal distress.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.